and welcome back to Cheung Chat. I am Dr. Jessie Cheung, and this is Jamie Cruz, my trusted right-hand woman.
Hi, everybody.
So, inquiring minds want to know, how do you talk to your kids about sex? We got a lot of requests from our patients who listen to us on Cheung Chat, and they're like, how do we translate this to our kids who are maybe thinking about it, learning about it, watching some YouTubes? So I have older stepkids and I have two little kids. So for my stepkids, we know that in school, junior high school, middle school, they learn about sex, meaning creation, right? But they don't really talk about masturbation or like, what do you do? So what I did to my stepkids was I pulled out my dermatology atlas and showed them scary photos of like warts and, herpes and stuff. Just said, look at this, because you can get these things transmitted if you're not careful. But really, what do you do?
Well, what age were they when you showed them this?
12, 13, 14, around there.
Okay,
Yeah.
all
And it was,
right.
these are pretty graphic photos, right? Now I'm like, guys, you can catch these things, girls too. But, besides shock value, what did you do, Jane? Because we have conversations with our patients a lot because they,
Well, I'm just going through it. So my kids are 13 and 14 right now. So I'm just going through this. And being that I am taking on so much of the sexual health here in the office and the phone calls that I get, it does spark a little bit of conversation that I know that I need to have. I don't want to have, but I need to have. And so I just kind of say it. I just say it to them. I mean, in a roundabout way, they're mortified, of course, but I tell them I'm only going to say this to you one time, so make sure you're listening, because as much as I don't want to talk about it, they don't want to hear it, but they also need to know. So I recently took some phone calls from some men because it's becoming more and more popular. People are feeling that they can come and talk to us about things. And situations from they're masturbating too much and they, started at the age of 14 and now they have zero sensitivity.
Yes.
They cannot get an erection, or they masturbate so much that they're now curving to one side. So I guess I just didn't realize that this starts at such a young age.
Yes.
And being the fact that this caller did start at 14 and I have a 14-year-old boy, it did spark a little bit of, okay, probably should have those conversations. So I did. And he heard me, and
it was actually a good thing.
it was a good thing.
Yeah.
And it's funny, I tell my friends this and they're all like, oh my God, you need to have this conversation with my kid. But I do think it's important because I would rather them know and hear it from me than them take it in their own hands and then all of a sudden 5 years from now there are issues and it really is affecting their life. When I took that call, my heart broke for this young man that called. And so if I can kind of save my kids from that a little bit, it's not an easy conversation to have,
Sure.
but it needs to be done. And so I told him one time a day, I know you're going to touch it. I know it's great. Do it. You're going to do it whether I tell you to or not.
Masturbation.
Yes.
Yes.
Not at the sex point yet, but he does need to know these things, and so does my 13-year-old. And when you start talking about those things, I mean, Dr. Cheung, you open this book up and you're seeing these photos of sexually transmitted diseases. That's a whole nother avenue of conversations that I'm going to have with my kids, because it's real. I mean, This is real stuff.
So we're talking just like baseline, just masturbation, because they're young, they're gonna touch it because it feels good, but just don't do it all day long. Because we get the calls where I see patients in the office, they've been doing it 5 or 6 times a day. They're desensitized, their penises don't work as well. You got the curvature going on. So yes, let's talk about the switching hands.
The switching hands. So one of the things with pyrones, those of you that don't know what it is, but it's curvature of the penis. So they're going to kind of tilt towards the way that they are manipulating it. And when you do it so often,
over and over,
it's just going to continue to go that way. So I learned that switch hands.
Yeah.
So you don't create the problem, and then we don't have to worry about correcting it. But switch hands. So I did tell my son, if you're into, make sure you switch hands.
Yeah.
Those of you out there that think, oh my gosh, I'm not having this conversation, I will say that my oldest brother gave me the best advice. He said, when you're ready to discuss it with your kid, you're 2 years too late.
Oh, God.
Because there's so much. When we were younger, we didn't have phones.
Yeah.
We didn't have.
You couldn't find porn,
Google
Yeah.
things like that. And if you think your kid isn't looking at it, you're wrong, because they're looking at it and they're researching it. And it's more comfortable for them to go and look up on Dr. Google than it is to come to mom and dad. So it's mom and dad's job to go to them. And so it's not a comfortable thing, but it's got to be done. So switch hands. once a day.
I like the graphic images too, but you have to talk about it in real, because they're like, oh my god, it's like, this is sex, but it's not masturbation. So,
Right, and these things are out there, and in the world of Tinder and all these other things that are going on, they do need to know that there are things out there that,
And how much is too much? How much masturbation is too much? If it interferes with your activities of daily living, because I have guys in their 20s who are like, they do it all day long apparently.
It therefore becomes up here.
How do you work? How do you eat? But that's what they're doing, especially it's shut in right now with, COVID and everything. So basically, hopeless helps, right? I mean, we can get more into depth about it as we go, but this is a starting conversation to have with your kids.
But have the conversations with them. I would much rather be uncomfortable, but my kids hear it from me and they hear the truth. Because as we all know, you can research anything on Google and you're gonna get the goods and you're certainly gonna get the bads. And that's our job. That's what we sign up for when we become parents.
And you're a good mom. We're good moms.
You're a good mom too.
Yes. So thanks for tuning into Cheung Chat. Please let us know what you want to hear about next, if this was informational and educational, because we're here to help. Communication is key, right? Education is power. Okay, thanks. Take care.
You.
Bye.